Today we're going to talk about one of the most common skin infection, which is the ringworm and its permanent cure in Ayurveda. A problem that is common in this season. Almost 30% of the Indian population has this fungal infection. The person may not discuss it with someone as it's a very private problem, very troublesome as it hampers the day-to-day activities. The rate of failures, the rate of reoccurrence, especially in dermatology, is just too high. In this video, we're going to understand why and how Ayurveda has set over 10,000 plus patients in 40 plus countries free from various skin infections in such a way that once cured, the disease never comes back. Often Ayurveda is chosen as a last line of treatment when all the things do not work. Initially, patient takes the treatment, gets relief, disease comes back again once the treatment is stopped, and this process goes on since years and years. It's very important to understand the causes because the treatment is always done as per the cause about which you'll have a very clear idea in this particular video. Namaste everyone, welcome back to Jyovis. Today we're talking about ringworm, a very common disease in this season. Once occurred, it may spread from one person to another or from one part to another. As the name itself suggests us, a ring, which is a circular structure, and worm refers to a fungus. There is no bacteria or no virus over here, it's purely fungus. As the name itself suggests us, ringworm, there is a circular lesion which has the margins that are thick, that are raised, and all of these are single lesions. There are various types of fungal infections like the epidermophyton, the trichophyton, microsporum, etc. The rates are increasing every single day, as we just discussed, very common in this season. The classification of fungal infection is done as per the location, although the rate of failure or the rate of reoccurrence is same in all the types of fungal infection. So as per the classification, if the fungus occurs on the scalp, it's called the tinea capititis. If it occurs over the face, it's tinea faciae. If it occurs over the beard, it's a tinea berberae. If it occurs on the groin area, which is the most common site of fungal infection, or initially, it's always seen at the groin area, which is called as a tinea cruris, also known as jock itch in common terminology. When the fungal infection occurs at the hands, it's known as tinea manum. Nails is the tinea unguium. Feet is the tinea pedis, also known as athlete's foot. When it occurs on the trunk, which is, let's say, the neck or the chest or the back, white spots are seen. It's called as the tinea versicolor. Most of the time it's misdiagnosed and the patient is given vitiligo treatment. There's a lot of difference in tinea versicolor and vitiligo. The right treatment is very important because both these diseases are totally different. Tinea versicolor is simply curable. Vitiligo is also curable with patient's discipline. The diet, line of treatment, and entire disease is different. So that's tinea versicolor, where white patches are seen. If it occurs at the body, it's called as the tinea corporis. And if it occurs on the overall body, all the body parts, it's known as the tinea universalis. In all these classifications, Ayurveda has the power, has the ability to cure all these types because it somewhere is fixing the root cause. For this, what is the root cause? Let's understand. So the various causes of fungal infection differs from person to person. Either one or two, three combination of these causes definitely a person has. Number one is the poor nutrition or the junk food intake, excess of sweet, sour, salty food, madhur, amla, lavan, rasatmak ahar, which increases the cough, which further increases itching. Kapha, nasti, kandu, shot. Kandu is the itching, shot is the swelling, nasti is the without. So no itching, no swelling without the aggravation of cough, which is because of excess of sweet, sour and salty foods, which is something that we often tell patients to avoid or reduce the intake of. Then the further cause is the stress, which further disrupts the rasa vastrotas. Why? Because chintanam cha ati chintanat rasa vahinya dushyanti. Stress disrupts the rasa vastrotas. The site of rasa dhatu is the hriday. If the first tissue of the body, the tissue is the one that holds us. If the first tissue doesn't get the nourishment, the uttar dhatus will absolutely not get nourishment. The other causes like the debilitating diseases or the diabetes, where certain medications, steroids are given since years and years. All these are immunosuppressants which suppresses the immunity, and because of the suppressed immunity, these infections the patient is more prone to. In case of diabetes as well, patients are immunocompromised. So for you to have the fungal infection, you're more prone to. These are the general causes. Again, the gut health is very, very important. The worm infestation is also commonly seen. Hence, from an Ayurvedic point of view, the treatment is done in various aspects about which we will discuss in just 1 or 2 minutes. Before that, let's understand patient initially chooses a treatment where the patient gets certain medicated soaps, ointments, internal medicines, completes a course, gets fine, again disease comes back, process goes on and on since years and years. The final call is the Ayurvedic line of treatment where the disease has spread across the body or has become very stubborn. In those cases as well, Ayurveda cures it. Why? This is the most important part of this entire video. So number one, let's talk about the junk food or the poor nutrition. As we spoke about sweet, sour, salty food, which affects the gut, intestine, which leads to or which leads to krumi, the worm infestation. Is the toxic waste product, right? So if the cause is the poor nutrition or the junk or the salt excess or the spicy in excess, in this case, certain medications to improve the gut health, to remove the to remove the krumi out from the body. For this, there is ajmodadi, hingvashtak, musta, kada to remove the To remove the krumi, certain krumingna dravyas like the vidanga, the musta, the devadaru is an excellent krumingna dravya. To remove this krumi, it's very, very important. Then the second cause is the stress. For this, again, as I told you, stress disrupts the rasa vastrotas. So for the proper, nourishment of the rasa pachak, which is the kutach, kutni and patol, a combination of this herb, this, medicine is given to the patient. For stress, there is the, antipsychiatric Ayurvedic medication, natural medicine, Jatamausi, Brahmi, Saraswat, Tagar is another medicine that's very useful over here. If the cause is the, let's say, immunocompromised diabetes or debilitating disease, medicines that give strength to the muscle, strength to the body, or immunomodulators are used. A simple example is Tinospora cordifolia. In cases where diabetes is present, then certain medicines that have two actions, one for the diabetes and one for the skin. For example, common herbs, an example would be Kira Tikta, which is Kadu Chirayat, or it could be the Neem, or it could be the Vijay Sar, which works great when it comes to both skin and diabetes. So in such a way, Ayurveda has to see the causes which work for those causes as well as work for skin as well. Along with this entire line of treatment, there are general kushtagna dravyas that are used, general skin medications like there is Khadir, Chok Chini, Nimba, Karanja. All these formulations are used which has the ability to cure the incurable of the incurable skin infection. If we talk about the herbs, there are endless herbs, endless formulations. There is Tuvarak, there is Bakuchi, there is Nimbadi, Gandhak Malahar, there are, Nirgundi, there are endless herbs that cures the root cause of the skin infection. Another important cause is excess of sweating. Patient says, if I get more sweating, I get the itching. In such cases, to reduce the overall sweating, like the Medo Pachak or the Medo Har or the Chandrakala Ras, which is a classical medicine to reduce the sweating. So as per the causes, the treatment is done. As per the causes, there are certain proprietary medications as well that are available that are prescribed by most practitioners, like the Active Ved India Twak C Med tablet or the Active Ved India Sora C Med syrup. Liver care also is a very important part, hence tablet Liv C Med and syrup Liv C Med of Active Ved India. These are commonly prescribed medicines by Jyovis, by many practitioners, which is a combination of herbs in extract form that takes care of all these causes. The stress, the poor nutrition, the immunomodulators, the krumi, as well as the So the herbs which have action, the herbs like the kada, ajmodadi, musta, hingvashtak, or the general medicines like the khadir, chok, chini, nimba, liver tonics like the kutki, stress medications like the tagar, the brahmi, jatamausi, all of these herbs are present in this livsi, swoxi or the sorasi. So there are the proprietary medications available as well. Very important in cases of stubborn skin infection or chronic infection where infection is old enough. patient has taken everything. In such cases, Panchakarma works great. The Vaman Virachan works great. If this is the AC and if there's a water, leaking out, I would not be someone who will clean this water. I would rather be someone who fixes this air conditioner. Similarly, the body has to be cleansed in the most authentic way, which is done by the oldest method of detoxification, which is the Panchakarma. The toxins are eliminated, the stroto dushti, which is the obstruction in the channels of the body, is fixed, the arm shuddhikaran is done, as well as the overall doshas which are aggravated are flushed out from the body. As you all have seen our videos, doshas when they are aggravated causes a disease. Doshas can be brought back to a balanced state with medicines, and the doshas that are aggravated which causes a problem, they can be flushed out with the help of Panchakarma. Overall, Ayurveda should be chosen as the first line of treatment for permanent result. Even in cases of last option, it has the ability to cure the root cause. We've discussed about the diet, the tips, the herbs, the general lepas, which is the khadir, the gandhak, the internal kadas, not the khadir arishta, but the internal kadas, the internal medicines in pure form, which has relieved many patients. The entire comment section talks about how patients have got the benefit from the simple natural remedies and how patients have started getting better by getting aligned with the nature. If you go against the nature, problems are going to be there. So this was all for now. Any doubts, any questions, let us know in the comment section below. Do like and share this video further. Until next time, from Jyovis and the team, look impressive, be progressive.